Hi, this is almost everything you need to know about the scapula. So the scapula is the posterior bone of the shoulder girdle. It's a large flat bone, and you can see there are two of them, and they reside posterolaterally on the superior half of the thorax. In fact, a good rule of thumb is that the scapulae overlie the second to seventh ribs here, fairly reliably, and therefore, by extrapolation, the superior and inferior margins of the scapula are good guides to the second to seventh thoracic vertebral levels. And this can be very useful. For an example, if you've log rolled a patient in a trauma situation and are palpating along the spine, you can use the superior and inferior margins of the scapula that you can palpate to estimate levels of any tenderness or other injury that you discover. Looking at the posterior surface of the right scapula in isolation now, which is here. So you can see that the scapula is a roughly triangular flat bone, and we can draw in borders in that case in a triangle. So the medial border here is the border that is aligned or closest to the vertebral column, so that's also in relational anatomy called the vertebral border. The superior border here is here, and this is the lateral border, which is again in relationships close to the axilla or axillary space, and so it's sometimes called the axillary border. So three borders and three angles. Because the medial border runs more or less vertically, at the top of it we have the superior angle, and at the bottom of it the inferior angle of the scapula, and that leaves the third angle to be the lateral angle of the scapula. The large flat surface is the body of the scapula. At the lateral angle, we have the articular surface for the head of the humerus, and the bone that bears that articular surface is the head of the scapula, this thickened area, and just proximal to that, the constricted area is the neck of the scapula, or anatomical neck of the scapula. By definition, an anatomical neck is the area where the joint capsule of a joint is attached, the capsular margins. And so that's where that occurs on the scapula, so therefore that is its anatomical neck. So if we drew in the joint capsule, we could say that it would be attached along the neck and then extend out over the joint, and would encompass the head of the humerus and would be attached on the humerus at its anatomical neck. The dorsal surface of the body of the scapula is divided into two unequal parts by this very prominent spine of the scapula. And the spine is a shelf-like projection that extends out posteriorly and somewhat superiorly, tilted superiorly from the dorsal surface, and then extends laterally, becomes quite thickened here, and then curves anteriorly as the acromion process. And the tip of the acromion process ends in an articular surface for the clavicle, which is the anterior bone of the pectoral girdle, and that forms the acromioclavicular or AC joint, which is arched over the glenohumeral joint or shoulder joint. The dorsal surface of the body of the scapula is divided, as I said, into two unequal surfaces. The surface above the spine is called the supraspinous fossa, and the surface below the spine is called the infraspinous fossa. And those are the sites of attachment of two rotator cuff muscles named for the fossae as supraspinatus and infraspinatus. If we turn now to the ventral surface or anterior surface of the scapula, again, in terms of relationships, this is the surface that is closest to the ribs and is sometimes referred to as the costal surface. It consists of one large fossa, and that is the subscapular fossa, and that is the site of attachment of a third, this time the anterior rotator cuff muscle, subscapularis. So those are the attachment sites of three of the four rotator cuff muscles, and we'll talk about them in another video. We see here again the glenoid cavity, or sometimes glenoid fossa, and the head of the scapula. and again the neck of the scapula along here. Just below the glenoid on the neck of the scapula is this tubercle, the infraglenoid tubercle, and there's a similar tubercle on the just above the glenoid fossa, which is obscured here, which is the supraglenoid tubercle. So infraglenoid and supraglenoid tubercles. The process that is obscuring the supraglenoid tubercle from our view is this finger-like projection that initially has come forwards towards us and then curves laterally, and that is the coracoid process of the scapula. Coracoid meaning in the shape of a crow's beak somehow to somebody at some time. We see here the projection of the spine of the scapula, the thickening as it becomes the acromion. The root Latin or Greek word for shoulder is omo, and acromion simply means the highest point of the shoulder. So acromion process here, and we're seeing here the articular surface for the clavicle at the AC joint, or the acromial part, scapular part of the AC joint. One other feature along the superior border here, we see this deep notch, which is the scapular or suprascapular notch. And in life, this is closed by a ligament, which is the suprascapular ligament, and that transforms the notch into a foramen, the suprascapular foramen. Foramen just means hole. And through the suprascapular foramen travels a nerve from anterior to posterior, so from the subscapular surface to the supraspinous fossa, the nerve travels. And that's the suprascapular nerve, an important nerve, a nerve of the proximal brachial plexus. We'll just explore that nerve a little more by considering a third view of the scapula. We'll take the opportunity. So superior surface here, scapular notch or suprascapular notch, suprascapular ligament, and now suprascapular foramen, and here comes the suprascapular nerve underneath the ligament through the foramen and gaining access to the supraspinous fossa. The nerve innervates the muscle of the supraspinous fossa, supraspinatus, and then carries on around this most lateral part of the root of the spine, curls around here and gains access to the infraspinous fossa, where it also supplies the infraspinatus muscle. So supplying the two of the three dorsal rotator cuff muscles is the one nerve, the suprascapular nerve. And finally, one last look at the scapula. This time, not that. This time with the ribs and the clavicle in view as well. So we see here again the infraglenoid tubercle, and we can perhaps imagine the supraglenoid tubercle here. Those tubercles are for attachment of the long heads of two important arm muscles. So the long head of biceps muscle is attached at the supraglenoid tubercle, and the long head of the triceps muscle is attached at the infraglenoid tubercle. So important attachment sites of muscles here. We see the AC joint, the acromioclavicular joint, at the tip of the acromion. We see the subscapular fossa related to the ribs here, so the costal surface of the body of the scapula. That's about all you need to know about the scapula. We'll talk about the axilla at length and many of the muscles that attach to the scapula in a separate video. But until then, enjoy the rest of your day.